Greetings, fellow Americans. Welcome to Fireside Chat, State of Our Nation. I am your host, Susanna Tanner, candidate for House of Representatives 2026 and President 2028. Last week, we talked about the National Wildfire Resilience and Forest Ecosystem Management Initiative. But a lot of what we're going to be talking about in the future has to do with healthcare and includes a lot of healthcare aspects into them. So today we are going to talk about the universal healthcare system that I put together. It is a comprehensive system. However, it is simplified. The Universal Healthcare Act performs a structural reset of the American medical system. It eliminates the 30% administrative waste of the private insurance companies model and replaces it with a zero cost at point of service framework funded entirely through Lockbox 7, or not 7, Lockbox 2 of the SAISA framework. The quality guarantee here is legal access rights, overflow protocol, and physician sovereignty. The legal right access codifies a federal right to care with strict wait time ceilings, 14 days for primary care and 30 days for specialists. I'm going to go into that a little bit today in detail because in the past there have been problems with some types of healthcare systems that cannot meet those types of deadlines. So one of the things this program does is works with outside providers to make sure that patients have the quality care that they need. And there is a financial setup for that, for reimbursement, which I will be going into at a later time. Now, overflow protocol. If the public system cannot meet these timelines, like I said, it's mandated to pay for private sector care and establish professional rates. So this is going to help our patients be able to be seen, as well as making sure that we're not flooding places like urgent care centers with patients who might only need to come in for a quick checkup. The physician sovereignty replaces most pre-authorizations with clinical discretion. However, because of certain medications that are highly regulated by the government and by, the FDA, a licensed doctor would need to make sure that, like they do now, that they have those signatures. However, those that don't really need pre-authorizations, we're gonna eliminate that. That's part of the administrative waste with insurance companies. Now, workforce protection is one of the aspects of the universal health care. Patients and doctors are, or not patients, this protects doctors and patients by mandating maximum daily patient load, or mandating maximum daily patient loads, ensuring every citizen receives dedicated diagnostic attention. However, keep in mind that those patient loads are at the doctor's and clinic's discretion. That way, we're not flooding clinics with an incredible amount of people who are only allotted 15 minutes for an appointment. You can't really treat a patient with 15 minutes. And it's incredibly frustrating for those who need to make an appointment, need to get in to see a doctor, and they can't do so because there is such a long wait. This provides a pathway for private sector billing and insurance staff to transition into the public health administration roles at competitive salary floors. The national compensation structure is something we'll be going over in a future date, as well as the revenue integrity. Briefly, it establishes the National Healthcare Fraud Task Force, 2,500 investigators to eliminate waste and billing abuse. And of course, pharma negotiations utilizes the Republic's unified buying power to mandate the lowest global price for prescription medication. Now, the fiscal impact of this, briefly, funded via a 20% earmark of the National Progressive Revenue Contribution Tax, 2.1 trillion annually. And it eliminates medical bankruptcy as a factor in the United States economy. There's quite a few people who really struggle with medical bills, and being able to eliminate medical bills this way, medical bankruptcy, is going to greatly increase the amount of funding that's able to flow back into our regular economy. And by funding universal health care through Lockbox 2, we are ensuring that every American has quality care. It's a one-payer system, single payer system. There is a lot more to the universal healthcare system, including some education aspects that I'll be going over in the next few weeks. For now, that is all I have. And apparently I did not switch my video, so I will make sure that if you cannot see this, that the actual video is released as quickly as possible. That's all I have for today. Thank you for your time, and may our path lead to peace and prosperity.